There is some potentially promising news about a coronavirus vaccine today. The CDC is telling states to start planning on distributing a vaccine for COVID-19 by the beginning of November.
And News 8 Now's Tyler Jobe tells us how our local healthcare systems are preparing.
It hasn't even been 6 full months since the coronavirus pandemic began, yet a vaccine could be on the way very soon.
So we are in a remarkable age of innovation, and pandemics do spur that, especially when the health of the entire global community is at risk.
Our local healthcare systems are now putting plans in place.
A lot of the factors on that have to do with how the CDC is going about releasing this vaccine.
Dr. Joseph Potaruca of Mayo-Clinic-Health-system says the vaccine would likely go to big cities first, like New York and Chicago, before getting to la-crosse. But once it gets here,
I would conjecture that we try to target vulnerable patient populations.
That includes the elderly and those with underlying medical conditions.
And maybe some vulnerable children, in addition to the frontline first responders, healthcare workers, and security agents, government.
Gundersen-Health-system has a similar plan.
Right now, the proposals are to administer the vaccine in different tier groups. The first priority would be vaccinating the healthcare providers who are at the front lines.
But even for those willing to get the vaccine,
it's going to be dependent on when we get our supply of vaccines, how much we get.
Infection preventionist Megan Meller says Gundersen already has flu vaccination clinics set up.
And a clinic for a COVID vaccine would be no different.
But before any vaccine gets delivered, it must be proven it's safe and effective.
You know, if we can really understand that this is safe up front, with a good number of patients in a phase 3 trial, maybe we would get benefit from running with it. So time will tell.
In la-crosse, this is Tyler Jobe, News 8 Now.
And Dr. Anthony Fauci, the country's top expert on infectious diseases, says if clinical trials prove that a vaccine is working safely and effectively, those trials could stop early. Everyone in those trials would then be able to get the vaccine.